Welcome to America's Home Place 2026 Open Enrollment. Let's start by introducing your benefits support team from Alera Group. They're here year-round to help with open enrollment, qualifying life events, and understanding how your benefits work. Whether you need help with coverage questions, claims, or finding providers or ID cards, support is just a phone call or email away. You can access the America's Home Place Benefits website by scanning the QR code or visiting the web address shown. The site includes plan information, resources, and tools to help you with your benefits. Open enrollment is your opportunity to review and make changes to your benefits. During this time, you can select your benefit options and add, remove, or update eligible dependents. All benefit elections made during open enrollment will take effect on May 1st, 2026. After open enrollment ends, changes are only allowed if you experience a qualifying life event. Open enrollment begins March 25th and ends April 6, 2026 at midnight. You must log into Employee Navigator to make your elections by the deadline, even if you're waiving coverage. All elections will take effect May 1st, 2026. If you have trouble logging in or need help during enrollment, contact the benefits support team by using the phone number or email shown. Next, let's highlight what's new and noteworthy for this plan year. Employees enrolled in a medical plan will have access to two new benefits, Garner Health and Text Care. Garner helps offset eligible out-of-pocket medical expenses when you use recommended providers. And Text Care offers 24/7 on-demand care for your household at no cost. We're also continuing our partnerships with trusted carriers like Anthem, Sun Life, and the Hartford to support your medical, dental, vision, disability, life, and supplemental benefits. Next, we will review who is eligible for benefits and walk through each benefit option available for the upcoming plan year. This overview will help you understand your choices so you can select the coverage that best fits your needs. Let's review who is eligible for benefits. Benefits are available to full-time employees who regularly work 30 hours per week or more. Eligible dependents include your legal spouse and children up to age 26, including disabled dependents who qualify. For full details on eligibility, please refer to the plan documents. In most cases, your benefit elections can't be changed after open enrollment unless you experience a qualifying life event. Examples include marriage or divorce, the birth or adoption of a child, or a change in other health coverage. If you have a qualifying event, you generally have 30 days to make changes. If you think you've experienced a qualifying event, contact Human Resources as soon as possible. Let's compare the three medical plan options available and help you evaluate which plan might be right for you. As you review each plan, consider how often you expect to use care, what you're comfortable paying in premiums versus out-of-pocket costs, and whether you want access to a health savings account. There isn't a one-size-fits-all option. The right plan depends on your personal and family needs. Let's talk about the High Deductible Health Plan, or HDHP. This plan has the lowest payroll premiums, which means less coming out of your paycheck each pay period. In exchange, you take on more responsibility when you need care, since you'll pay more out of pocket before the plan begins to cover costs. In order to reduce your overall responsibility, America's Home Place will provide an employer HRA contribution of $1,000 for employee-only coverage or $2,000 if you elect employee spouse, employee child, or family benefits. More information will be shared later in this video. Preventive care is still covered at no cost, and this plan allows you to contribute a health savings account, or HSA, which lets you set aside pre-tax dollars for medical expenses now or in the future. Don't forget, you also have $0 telehealth services provided by Text Care. This option may be a good fit if you don't expect to use a lot of health care during the year and want to save on premiums while building long-term savings through an HSA. Now let's talk about the Core PPO Medical Plan. This option is designed to balance your monthly premiums with more predictable out-of-pocket costs when you receive care. While the premiums are higher than the HDHP, the deductible is lower, and many services are covered with set copays. To reduce your overall responsibility, America's Home Place will provide an employer HRA contribution of $1,000 for employee-only coverage or $2,000 if you elect employee spouse, employee child, or family benefits. More information will be shared later in this video. Preventive care is covered at no cost, and common services like office visits, urgent care, and prescriptions are typically covered with copays rather than paying the full cost after the deductible. Don't forget, you have a $0 telemedicine service provided by TextCare. This plan may be a good fit if you expect to use healthcare throughout the year and prefer knowing what you'll pay at the time of service, even if that means slightly higher payroll deductions. This plan also uses pharmacy levels, which can affect how much you pay for prescriptions. Level 1 pharmacies are preferred pharmacies and generally offer the lowest out-of-pocket costs. These include many well-known locations like CVS, Walmart, Kroger, and other major chains. Level 2 pharmacies are still in network, but your costs are typically higher when you fill prescriptions there. These may include pharmacies like Walgreens, Rite Aid, or other national retailers. To save the most on prescriptions, it's a good idea to use a Level 1 pharmacy whenever possible. You can check your pharmacy level through the carrier's website or mobile app. Now let's look at the buy-up PPO medical plan. This option offers the lowest deductibles and overall out-of-pocket costs of the three plans. In exchange, it has the highest payroll premiums. To reduce your overall responsibility, America's Home Place will again provide an employer HRA contribution of $1,000 for employee-only coverage or $2,000 if you elect employee spouse, employee child, or family benefits. Preventive care is covered at no cost, and many services are covered with copays similar to the core PPO plan, but with lower cost sharing when you receive care. Like the other plans, don't forget you also have $0 telemedicine services provided by TextCare. Unlike the core PPO plan, there is no distinction between pharmacy levels under this plan, which can make prescription costs more straightforward. This plan may be a good fit if you expect higher medical usage, want the most predictable costs when receiving care, and are comfortable paying higher premiums for richer coverage. When it comes to healthcare, where you go for care really matters. For routine or non-urgent needs, starting with TextCare is the easiest option and is zero cost to you. Otherwise, you can try your primary care provider or urgent care that can save you both time and money. These options typically have shorter wait times and lower out-of-pocket costs. Emergency rooms should be reserved for true emergencies, such as severe injuries, chest pain, or symptoms that feel life-threatening. By choosing the right level of care, you can get the treatment you need while keeping your healthcare costs as low as possible. Now let's talk about TextCare, your on-demand virtual care benefit. TextCare gives you 24/7 access to a dedicated team of clinicians through text, phone, video, or secure chat, with an average response time of just a few minutes. If you're enrolled in a medical plan, TextCare is available at no cost for you and your household. Your care team can diagnose and treat common conditions, help with prescriptions, and guide you to in-person care when needed, all with follow-up support after every visit. It's a simple, convenient way to get care anytime, anywhere. Garner Health is a new benefit available to employees enrolled in a medical plan. Garner helps you find high-quality, in-network providers and then helps reimburse eligible out-of-pocket medical expenses when you use those recommended providers. The reimbursement can include things like office visits, prescriptions, imaging, outpatient services, and hospital care. Essentially anything covered under your medical plan when you use a Garner-recommended provider. This benefit is designed to help you make smarter healthcare choices and reduce what you pay out of pocket while still receiving high-quality care. Let's walk through how Garner Health works, especially if you're enrolled in the high-deductible health plan. Before Garner begins reimbursing expenses, you first pay a portion of your deductible, $1,700 for individual coverage or $3,400 for family coverage. These expenses are eligible to be paid using your HSA or health savings account if you have one. After you reach that amount, Garner begins reimbursing eligible out-of-pocket expenses up to $1,000 for individuals or $2,000 for families, as long as you use Garner recommended providers. If you exhaust your Garner reimbursement, you would then continue paying towards the remainder of your deductible. Once the deductible is met, your medical plan generally covers most services. Garner automatically tracks claims and issues reimbursements, helping reduce what you ultimately pay out of pocket while guiding you to high-quality care. The Sydney Health mobile app gives you easy access to your Anthem benefits anytime. Using the app, you can find in-network doctors, compare costs, check claims, view digital ID cards, and track your plan progress all in one place. You can also manage prescriptions and get answers to benefit questions directly through the app. To get started, download the Sydney Health app or set up an account at anthem.com using the link shown. The Wellbeing Solutions program is designed to help you focus on your health while earning rewards. By completing eligible wellness activities, such as preventive care visits, health screenings, or working with a wellness coach, you can earn rewards totaling up to $700. You can choose which activities to complete based on what's relevant to you, and rewards can be redeemed for electronic gift cards from popular retailers. Keep in mind that these rewards are considered taxable income. You can track your progress and redeem rewards through the Sydney Health app or by logging on to anthem.com. Now let's review the dental plan options. Both plans cover preventive care like exams and cleanings at 100%, helping you stay on top of your oral health. The main difference between the two plans is the annual benefit maximum. The lower plan provides a lower annual maximum, while the higher plan offers a larger maximum, which can be helpful if you expect more dental work during the year. Both plans also cover basic and major services, such as fillings and crowns, with the higher plan providing more coverage overall. Orthodontia is available for eligible children under the higher plan. Choosing the right dental plan depends on how often you expect to use dental services and whether you anticipate needing more extensive care. In addition, these plans include a rewarding annual preventive care feature. When you receive preventive dental services, you can earn additional benefit dollars that increase your annual maximum in future years. This encourages regular preventive care and helps you build extra coverage for more extensive dental needs down the road. The Vision Plan covers routine eye exams, lenses, frames, and contact lenses, helping you maintain your eye health and manage vision-related costs. You have access to a large nationwide network of vision providers, including private practices and well-known retail locations, giving you flexibility in where you receive care. The plan also includes allowances for frames or contact lenses, along with low copays for exams and lenses. Regular eye exams are important not only for vision care, but they can also help detect other health conditions, making vision coverage a valuable part of your overall benefits. Out-of-network coverage is also available. You may use providers outside the Blue View Vision network by paying in full at the time of service and submitting a claim for reimbursement up to the plan's out-of-network allowance. Routine eye exams and prescription eyewear are still covered. Your employer-paid life and disability benefits are provided at no cost to you. The company provides basic life and AD&D insurance equal to 2 times your annual salary up to a maximum of $100,000. You're also covered by short and long-term disability benefits. Short-term disability replaces a portion of your weekly income after a brief waiting period, while long-term disability helps replace income if you're unable to work for an extended period of time. These benefits are an important part of your financial protection and are designed to support you and your family if an unexpected illness or injury occurs. Please note, your disability benefit may be reduced by other sources of income, including benefit payments from state-mandated disability and leave programs and Social Security disability. For coverage to be effective, employees must be actively at work. Employees who are currently disabled due to an injury or sickness will have coverage delayed until they return to active employment. Voluntary life coverage allows you to elect additional life insurance for yourself, spouse, and eligible children beyond the employer-paid coverage. Coverage is available in set increments up to plan limits and includes guaranteed issue amounts when you enroll during your initial eligibility period. This simply means you can elect coverage up to certain amounts without answering medical questions. Voluntary life can be a helpful way to provide added financial protection for your family based on your personal needs and circumstances. Please note that if you're married and both you and your spouse work for America's Home Place, you cannot be covered as both an employee and as a dependent. A dependent cannot be covered under more than one employee, and no one may be insured as a dependent if they are already covered as an active employee. Critical illness insurance is a voluntary benefit designed to provide financial support if you're diagnosed with a serious medical condition. Critical illness pays a lump sum cash benefit directly to you if you experience a covered condition such as a heart attack, stroke, cancer, or other serious illness. The benefit is paid regardless of your medical plan coverage and can be used however you choose for medical expenses, household bills, travel, or time away from work. You can elect coverage for yourself and in some cases for your spouse and children based on the plan options. This coverage can be a helpful way to add an extra layer of financial protection during a difficult time. Accident insurance is a voluntary benefit designed to help cover unexpected costs if you're injured. It pays a lump sum cash benefit directly to you based on the type of injury and treatment you receive. It covers accidents that happen both on and off the job. The money is paid directly to you and can be used however you choose for medical bills, deductibles, copays, or everyday expenses. There are no medical questions required to enroll, and coverage is portable if you leave the company, with no limitations for pre-existing conditions. This coverage can be a helpful way to add an extra layer of financial protection in the event of an unexpected injury. Hospital indemnity insurance is a voluntary benefit designed to help with costs that can come with a hospital stay. It pays a lump sum cash benefit directly to you if you're admitted to the hospital. The payment is based on the length of your stay and the type of care you receive, such as time spent in the ICU. The money can be used however you choose to help cover out-of-pocket medical costs, deductibles, or everyday expenses like rent, food, or transportation. The coverage can be especially helpful when paired with a medical plan, providing added financial support during an unexpected hospitalization. Now let's review supplemental wellness benefits available with Anthem's accident, critical illness, or hospital indemnity coverage. When you complete an eligible health screening, such as a mammogram, colonoscopy, or routine blood work, you can earn a $50 cash benefit per plan per year. Covered dependents may also be eligible. To receive the benefit, you simply submit a claim after your screening is complete, and the payment is sent directly to you. This benefit is designed to encourage preventive care while putting extra money back into your pocket for taking care of your health. The Employee Assistance Program, or EAP, is provided through Hartford's Ability Assist Counseling Services. The EAP offers confidential support to help you and your household navigate life's challenges, including emotional counseling, financial guidance, and legal support. You have access to counseling services, as well as unlimited phone support for financial and legal resources, all at no cost to you. If you need help, you can contact the EAP directly using the phone number or website shown. Support is available when you need it, and all services are completely confidential. The Health Savings Account, or HSA, is available if you enroll in a qualified, high-deductible health plan. An HSA allows you to set aside money on a pre-tax basis to pay for eligible healthcare expenses such as deductibles, copays, and prescriptions. The money in your HSA is yours. It rolls over from year to year and can even be invested for future healthcare costs. HSA funds can be used for you, your legal spouse, and your tax dependents, and there's no use it or lose it rule. This can be a powerful way to save on taxes while preparing for both current and future medical expenses. Before you finalize your elections, there are a few important reminders. Take time to review your benefit options, and if applicable, discuss them with your spouse or family members. Be sure to log into Employee Navigator during open enrollment to make your elections, even if you're waiving coverage, and confirm or update your beneficiary information and mailing address. Remember, once open enrollment ends, you won't be able to make changes unless you experience a qualifying life event. New benefits will take effect on May 1st, 2026, and ID cards will be issued if applicable. Now let's review your next steps for open enrollment. Log into Employee Navigator during open enrollment period to review your personal and dependent information and make your benefit elections. Follow the prompts in the system and be sure to click Complete to finalize your elections. Once submitted, print or save your benefit confirmation for your records, and you'll receive a confirmation email at the email address on file. As a reminder, you're never on your own when it comes to your benefits. If you have questions or need one-on-one assistance, you can always reach out to the benefits support team. Insurance can feel overwhelming and complex, and help is available to walk you through your options, answer questions, or assist with enrollment. You can contact the team by phone or email using the information shown whenever you need support.